Hey there, listeners. Thanks for stopping by to the podcast today. Please, before you're done listening to this episode, leave us a review. If you're on Spotify, you can review now, and you can also review on Apple Podcasts. But if there's any platforms that I'm forgetting about and you can leave us a review, please do so. If you're happening to watch this on YouTube, and if you don't know, you can watch these podcasts on YouTube now, please like and subscribe to the channel and share the episode as well. So thanks for stopping by, everybody, and enjoy the episode.
Knowledge is Power is where you come to hear people's life experiences to learn from. So, without further ado, let's roll the intro.
Stay hungry, stay foolish.
We choose to go to the moon in this decade and do the other thing, not because they are easy, but because they are hard.
I have a dream. Will one day live in a nation where they will not be judged by the color of their skin, but by the content of their character.
Hello and welcome back to the Knowledge is Power podcast. Sorry guys, it's been a little while, but I promise you I got a really interesting topic and a great guest on today. So if you could go ahead and introduce yourself, that would be great.
Hey, and good morning. It's great to be here. My name is Elizabeth Rochin. I am the president of the National Perinatal Information Center here in Providence, Rhode Island, and live here in Charlestown, Rhode Island.
Great, yes. So much like one of the previous episodes, when I had on two amazing female entrepreneurs, I'm a little out of my depth here. So if you could go ahead and explain sort of the company and what you do, I think that would be a really great starting point.
So, and happy to do it.
Yeah.
So the National Perinatal Information Center is a national organization, not-for-profit, located here in Rhode Island, that focuses on the quality improvement for maternal and neonatal care in hospitals across the nation. Mm-hmm. So we focus on helping and supporting obstetric teams and neonatal teams.
Explain what neonatal means.
Neonatal. Thank you so much. So obstetric is childbirth.
Okay.
And, the postpartum period. And neonatal is, the newborn period while they're in the hospital. So we focus on improving outcomes in hospitals across the nation for moms and babies.
Okay, very cool. All right, then you can continue on with the work.
Sure. So what we do is we provide benchmarking information for hospitals to understand how are they doing. Mm-hmm. So certainly they can measure their own outcomes. They can see how they're doing as far as when it comes to, how their deliveries are doing, how safe their deliveries are, what their cesarean delivery rate is. What other types of metrics are important to measure. Mm-hmm. And so it's important to not only measure within your own organization, but then how do you compare to other hospitals like your own? For example, if you're a hospital in Texas, how do you compare to a hospital in Illinois or in Florida or in New York? Mm-hmm. So being able to compare that information helps you better establish not only how to do it better, but what hospitals can you connect with to learn how to do it better.
Okay, very interesting. All right. All great information. So why don't we start, we'll go a little bit backwards here, and let's talk about your life story.
Okay.
If you want to talk about where you're from and sort of how you got to this point in your life, that would be great.
Sure. So I have been a nurse for 33 years.
Wow.
And so I went to nursing school in Syracuse, New York. And a little bit of a funny story about that. So when I was in high school, I went to a multitude of high schools because we traveled, because my dad moved around quite a bit. And so, of course, we did too. And so I graduated from two high schools. I was in my senior year of high school and started my first, 4 months at one high school and then moved in January of my senior year of high school. Note to self, don't ever do that to a child when they're in high school. So finished out the second half of my senior year in a school outside of Syracuse, New York, in Mexico, New York, actually. And
I didn't know there was a
there's a Mexico, New York, right on Lake Ontario.
Wow.
So what you discovered, at least at the time, what you discover is that if you are not a resident of a state for at least a year, you do not receive in-state tuition.
Oh, yeah.
So suddenly every state was now out of state tuition for me. And knowing so well that I wanted to be a nurse, I had wanted to be a nurse since I was about just off of the ground. It was challenging to try and figure out how was I going to become a nurse, especially since suddenly tuition was so high. So come to find out, there was a little school of nursing in Syracuse, New York, Krauss-Serving Memorial Hospital School of Nursing. And they were offering a program that's called Tuitions on Us. So basically, they paid for the tuition up front. And then the expectation was either you paid it back at the end or you worked for that particular hospital for 2 years, which, note to self, we should do more often today. And we can talk about that later.
Absolutely.
So, but in any event, became a nurse, got married, moved to Philadelphia, and the rest is history. So I started out the first 13 years of my nursing career in the pediatric intensive care unit, then moved to mother baby, and then just started my leadership trajectory and have really had a great time. If I've learned anything about nursing is that it's versatile. You can literally do anything, and it offers opportunities that I never dreamed of.
Great. Awesome. So I need to stop using the word awesome so much. So what was the moment that sort of sparked your interest in nursing? Because you mentioned since you were a little kid, but was there anything you can remember that sort of sparked that?
So my dad had his first heart attack when he was 42 years old. Going back even before that. Let me go back even before that. So my sister was a 24-week premature newborn in 1972.
Oh, wow.
Which was completely unheard of. And so I remember early on being at the hospital quite a bit when I was, even I have these momentary glimpses of still seeing, hallways when I was really little, because we went to the hospital so often when she was small. And so my sister is completely blind. She developed what's called ROP, or retinopathy of prematurity, which was extremely prevalent back in the late early 70s, because they just hadn't learned how to use oxygen well with, these very fragile premature babies who, basically their retinas became detached from the oxygen, just to basically simplify it. But so spent a lot of time in hospitals. And then my dad had his first heart attack when he was 42. So I was in junior high and spent a lot more time in hospitals then, and really recognized and started to see early just the impact that a good nurse, that a compassionate nurse, that someone who really cared about my dad, but also somebody who cared about his family, really, and the difference that could make. And so really, that just started to reinforce the desire and the need to be able to not only help people where they are, but help their families, be able to navigate the tremendous challenges that exist, within healthcare, within disability, within, ill health. I also learned that, as I went through my nursing career, people think of having a baby as the best time of your life. And as you learn going into labor and delivery and working there, as you learn other ways, that can be the best time of your life or the worst time of your life. And having someone there with you, having a nurse who is supportive, compassionate, who has empathy, who can really support not only you as the patient, but support the family and help them be able to kind of establish normalcy, or at least even a semblance of normalcy before, during, and after that type of event. But just kind of getting back to my dad, just the connections that a good nurse, a strong nurse, a compassionate nurse could make, and kind of supporting the family through that type of event is so important. I remember quite frankly giving my own father CPR when he had his first heart attack, and that still sticks with me. But it's just such a good nurse is worth their weight in gold, and being able to help support the nursing workforce, help to be able to draw people into the nursing workforce and support that is so vitally important right now.
Absolutely, yeah. Especially in the past few years, they have definitely had to work harder than I think they ever thought they would. Absolutely insane, and I couldn't thank those people more. Luckily enough, I've been, I guess, blessed not to be in contact with them in hospitals all that often. So don't know a lot of nurses, but I know they're all heroes. So thank you very much for doing what you do.
Well, I certainly in my own role today as the president of the National Perinatal Information Center, I certainly can support nurses, in my own way. I certainly do not have, they have my utmost respect for being able to do the work that they do, particularly through the last couple of years. And even now, as we emerge out of, the depths of COVID, there's the residual effects on nursing, and we're seeing them every day with the continued decrease in enrollment in nursing programs, with the continued exodus of nurses away from healthcare. That is certainly something that we all have the opportunity to influence,
right,
and ensure that we have a vibrant and, energetic and, compassionate workforce for nursing in healthcare.
Yeah. And I think the unfortunate thing is a lot of politicians that will say nurses are heroes and say all these great things, but then not do anything for them, which is really unfortunate, which is something that really came through during COVID. It was all talk and no walk, and it was a very unfortunate reality that a lot of people witnessed, just from watching the news. And it's a very sad reality that's sort of procured throughout the past couple of years. And I think we could get into a little bit of a controversial topic, but depends on how the conversation flows. But let's get off of that, and let's sort of explain how I'm really interested to hear or as you sort of worded it a little earlier, your track to leadership or something along those lines. Really, really amazing line of words there. But can you explain how you were, I don't want to say just, but a nurse to where you are now, and sort of the steps you took to get into the leadership role you are today?
So the very fortunate part about it is that I had really good, I had two things going for me. I had a really supportive family who really supported my development, who supported my years of school, my years of missing dinners, of missing games and such because I had a paper due or a project due or something like that. So I had an incredibly supportive family. The other thing that I had was a very supportive boss, who was just dynamic and such an excellent role model for leadership, an excellent role model for being able to navigate the politics of healthcare, but also navigate the politics of nursing. My husband would be the first to say that she was not a very good role model because I never got the work-life balance thing right. So I'm just going to own that right now.
Shout out to Peter, who's refused to come on the podcast.
So, but in any event, this particular leader did something that I think was really was really brave, but also at the same time took a risk. And she literally pushed me out of the nest. She said, if you want to grow, you are going to need to leave. And at first, I felt like that was a slight. At first, I felt like she doesn't want me. She doesn't want me here. But in fact, what she was doing is she was helping me to grow my strength, to extend my wings, extend my aperture for looking at things. And I forever will be grateful for this one particular leader who pushed me out of the nest. And if there's anything that I would say about, nursing leadership is twofold. Number one, don't be afraid to push your good folks out of the nest for opportunities that could really help elevate them in their role going forward. And number two, don't be afraid to get pushed out of the nest. And sometimes it's sometimes growing that confidence, being able to take that risk and that leap, because we're all risk averse. We all are afraid of taking risk. But once you're able to take that risk, once you kind of step off the cliff and know that there's something underneath you, whether it be the support of your family, the support of others who are around you and surround you, it can really be a powerful element. So I would say the two things are, don't be afraid to push someone out of the nest, and don't be afraid to jump out of the nest yourself.
Yeah. And something else out of that experience is surround yourself with great people.
Yes.
Right? It's funny, you hear a lot of people say, I don't know, online, just around, music can shape your mood. Like when you're in the car and you see the videos of, like, I think there's a Family Guy clip of Peter Griffin driving, and he, like, let's say he's listening to Taylor Swift and he's super happy, and then he hears that song Seasons in the Sun and he's super sad. You know what I mean? So just like how music can shape the mood you're in, the people you surround yourself with can shape the type of person you are.
Without
right?
question.
Absolutely.
Without question.
So
it can be very powerful.
Yeah.
But I would also say that in one of the best leadership times of my career was when I was within an organization in North Carolina, Rex Healthcare, and I was offered an opportunity to take on a new unit, and it had risk. It also had opportunity. Some of those years were the best years I have ever spent in nursing. The ability to help a team shape itself, reshape itself, reform itself around a totally new patient population. But one of the things that I really learned is that not only surround yourself with those who support you, but also find some naysayers. Find some folks, find the reason, why shouldn't you do something? Why, what are the risks? What are those things you should think about? And when I say naysayer, I don't necessarily mean someone who's negative,
right.
But also be able to look at the entire picture. What are the things you might be missing? What are those experiences or those elements of a particular change that you need to think about, but you really haven't, you might have your blind spots. And being able to find a very versatile and diverse group who can help shape and form your experiences can be just as much, if not more valuable. Some of the greatest people I've had shape some of my experiences have been some of those naysayers, where really what they were trying to do is they really did care about their environment. They did care about what was going on. And so that squeaky wheel, so to speak, was just enough to be able to learn, okay, what's the oil that I need? What's the change that we need? What's the change that we need to develop to be able to create a positive course of action that can then set a really great trajectory for everybody.
Yeah. Wow. All right. So next question. Can you give us an overview on the maternal and neonatal, right?
Neonatal.
Neonatal health landscape in Rhode Island, and what are some of the key challenges that the state faces, or challenges that this area faces?
So that's a really interesting question, and there's a couple of things that we could just dive into very quickly.
Yeah.
First of all, there is some tremendous racial inequity and disparity in maternal outcomes. Severe maternal morbidity and severe maternal mortality are two terms that we utilize quite a bit in the perinatal discussion. So severe maternal morbidity are those things that can create harm, or either temporary or permanent harm for a new mother. And so there is tremendous disparity in postpartum hemorrhage. There's tremendous disparity in severe maternal hypertension. There are some key areas that organizations are looking at, and one of those of which that the Perinatal Neonatal Quality Collaborative of Rhode Island, which is still in its infancy, but each state has what's called a perinatal quality collaborative, and it's a convening, if you will, of physicians, nurses, community members, insurance payers, government entities, anyone who's really committed to improving the health and well-being of mothers, particularly in this case, from the maternal quality collaborative perspective. Rhode Island is really focused on doing both, on being able to elevate the care of both maternal, of moms and newborns. So in looking at some of the data that exists for Rhode Island, one of the challenges is substance use disorder, and really finding opportunities to help new moms and their families be able to help create solutions and strategies to things like substance use, overdose, unintentional overdose, accidental overdose. So overdose is one of those things that we look at and try and figure out what are some of the best ways to be able to navigate that. Unfortunately, throughout the nation, mental health in general has a tremendous stigma associated with it, associated with treatment, associated with identification. So even someone coming out to be able to basically help, get help for themselves, so to speak, it's hard because there is a stigma that continues to be associated with mental health. There is an increased stigma when it comes to maternal mental health, because suddenly new moms and such are concerned. If they're diagnosed with something, is their baby going to be taken away? What opportunities or threats exist for, asking for help and looking for help? So really trying to hone in on what are some of the community aspects of this that we need to look at. What are the community supports that we need to look at to be able to support new moms and new babies in their community, in their environment. And some communities are much better resourced than others. In fact, one of the new initiatives is that I would wager that most people don't know that insurance carriers are now required in Rhode Island to provide doula support. And what a doula is it's a certified it's an individual who is certified that has been trained in specific activities and promotion of childbirth, of the postpartum period. And those doulas can be a tremendous and vital resource to our communities here, and many don't know about them.
Interesting. Yeah, and that issue of racial inequity can get into a much deeper issue as well. And it's great that you guys are focusing on that and helping anybody who needs it. It's so important to have a parent present, in a child's life. You've seen movies and TV shows of kids that grow up without parents, and it's rough, and having that support is very important in helping these people. And another unfortunate reality is that there is an opioid crisis in Rhode Island right now. Recently, you've seen it, I don't know, the past couple of months it come up, and it's really sad, but at the same time, it's great that you guys are here to help. So can you explain some of the processes or programs that you guys are sort of headlining to these people to help them, or is it's still in the works? Or
so the quality collaborative here in Rhode Island is still in its infancy. It is still growing. It's still gaining momentum. There, we are meeting as an organization. We're meeting as a group. There are, it's basically a grassroots effort at this point to really kind of help strategize the best way ahead. There's two initiatives that are ongoing here in Rhode Island currently. One is the Alliance for the Innovation in Maternal Health. It's also called AIM. And what AIM does is it helps hospitals to implement what are called patient care bundles in hospitals to help create and promote patient safety for maternal outcomes. For example, there's a bundle on severe maternal hypertension and what teams need to do to be able to prepare for that, to be able to respond, react, and treat. The same thing with postpartum hemorrhage. If a woman after childbirth or before starts to show signs and symptoms of postpartum hemorrhage, how do you respond to that in the hospital? And there's other patient care bundles. And in fact, I would certainly encourage women who are going to hospitals, tell me about how you're utilizing your patient care bundles here and how can I be supported through their use. So really kind of helping hospitals really understand and better utilize those bundles is really what AIM is about. AIM is part of the Perinatal Quality Collaborative here in Rhode Island. And so again, that's still in its infancy. It's still kind of with its groundswell, making sure that we can provide and promote the strategies necessary for Rhode Island to help care for moms and babies now, but also in the future. Being able to look at how to create better and more efficient health equity, birth equity, how we can help to amplify the voices of those who are most impacted and affected, and making sure that communities have the resources and the information that they need to be able to provide the best care.
Hey there guys, sorry to interrupt the episode, but I just wanted to tell you that I got my real estate license in the state of Rhode Island. So if you need to buy, sell, or need help renting a property in the state of Rhode Island, feel free to reach out. Contact me at maxwellwillett@kw.com or call me at 401-487-4477 and I'd be more than happy to help you. Thanks guys and enjoy the rest of the episode.
Care for moms and babies. In fact, the World Health Organization has specifically stated the barometer of a society is the way in which it treats its mothers. So being able to assure that we have solid structures that are available for moms here in Rhode Island is so important.
Yeah, absolutely. I understand if you can't talk about a particular case, but is there something that comes to mind where something has aroused, a situation has came up, and how you guys address the situation and how you guys have solved it by helping somebody?
So we are looking forward to the day when we can do that.
Yeah, okay.
We're not quite there yet, but
Okay.
what I will say is that like for the AIM program, for example, the AIM program here in Rhode Island received funding to be able to support a program called the Post-Birth Warning Signs Program.
Okay.
It is an educational initiative through the Association of Women's Health, Obstetric, and Neonatal Nurses. And what that is it is an education program for nurses, but it helps to give information to new moms about what signs and symptoms they should be looking for when they, after they've gone home from a delivery, what signs and symptoms they should be looking for to be able to contact their provider or call 911 if they're having severe symptoms. And so we've anecdotally heard from hospitals as well as others that people are making that phone call, that they are looking at that information, that they are calling 911 or they are calling their provider to say, there's something going on, I need to be seen. And so that is starting to work. We're hearing reports that that's working, which is really great. Now what we need to do is we need to make sure that every voice is heard when they call for help, when they call their provider. Because one of the issues nationally that we face is that Black women particularly are not listened to in the way that others are. So when Black women, for example, say, I have a headache or I'm not feeling right, they'll hear more often, it's just pregnancy. You'll get over it. Those types of things. There have been some very nationally known women. Serena Williams, for example, comes to mind. She's one of the loudest voices of listen to women when they're telling you about their signs and symptoms that they're experiencing during pregnancy or just in the postpartum period. Listening to women is so important. And our ability to do that and channel that is going to really help to focus how we can care for all new moms here in Rhode Island.
Absolutely. So it sounds like a huge part of what you guys are doing is education.
Yes.
So unfortunately, I mean, I'm probably guilty of this. There's a lot of thick-headed people out there who don't want help or say they don't need it. What are some of the steps you're taking to sort of introduce it in a way where people realize, oh, wait, maybe there is something here. Maybe I do need help. Maybe there are things I need to learn. What are some of the processes you guys are going to implement in the future to help with that?
So a couple of the things we look at are, I think that sometimes folks stop asking for help because they don't receive it. That they've asked for help or they've asked for things and it just falls onto deaf ears. So a couple of things that we are looking to do is we're looking to be able to, there are what's called social determinants of health, are also known as health-related social needs. So for example, if you are a new mom who has heard that you need to go back to your doctor's office to be able to be seen because you have hypertension, that sounds really good. But if you don't have a car, if you have other children at home and you don't have resources available to be able to care for those other children and your newborn while you go to the doctor's office, then that makes it really tough. So making sure that we're identifying the needs that are necessary to promote, well newborn care, postpartum care in the community, making sure that we're addressing those needs in a way that is individualized, but also there's the need of individualizing care, but also how do you look at this from a population lens? How do you look at this from the totality of maternal care? And where do we start to really see the opportunities in the areas that we can improve on? And being able to elevate the groups that are working on these things, being able to elevate the voices that are working on these things, and making sure that everyone has an equitable opportunity to be a really great mom, a really healthy mom, and raise a really great family.
Yeah, absolutely. And could you talk about the role of technology in this and how it has an innovation as well in improving maternal and neonatal health outcomes, and how the collaborative is leveraging the technologies and innovations?
So again, in our infancy, of course, we're going to start looking at ways that we can help, create opportunities for technology to help support maternal health out in the community. In fact, Women and Infants Hospital sends, women home with blood pressure cuffs, for example, to be able to take their blood pressure if they meet specific criteria, particularly for history of hypertension. And other hospitals are starting to fashion behind that. Of course, that takes money and that takes grant funding. And so being able to leverage funding to support that type of technology at home is really important.
Absolutely.
So there are what are called femtechs or female tech companies that are coming online all the time for wearable devices, for the ability to connect, digitally, remotely with physicians or providers or nurse practitioners. Technology is a very broad umbrella. And so being able to understand the discrete ways that certain technologies can help, whether it be in the home, whether it be in the physician's office, whether it being the provider's office, being able to connect to a provider, virtually, as opposed to, going into the office. There are so many ways that we'll be able to leverage technology for maternal health and maternal mental health. In Rhode Island, it's, a lot of that is going to have to do with grant funding or federal funding to be able to do this and support these types of initiatives that are required to help support maternal health.
Right. Yeah. And, oh man, I lost my train of thought there. What was I going to talk about? I'm sure it'll come back to me. So AI not really out of nowhere, but with ChatGPT coming onto the scene, has taken a huge role in a lot of different things. You're seeing AI everywhere. I know this is sort of a far-fetched question, but is there a role you can see AI playing in this atmosphere?
So I think that in some ways, AI is going to be able to really start to engage in population health, in really being able to not only give you data, but also be able to predict certain outcomes based on looking at volumes and volumes of data.
Right.
In fact, the national, where I work at the National Perinatal Information Center, we do some of that already with some of our reports, not necessarily, AI in that vein, but we do like to look at ways that if you look at information now, how, based on the outcome, how predictive it may be for certain events in the future.
Right.
AI, I think, is going to have a very unique opportunity from a population lens to be able to look at, this type of maternal outcome, this type of neonatal outcome, and based on all of the data, and then projecting forward the types of not only, outcomes, but what types of interventions can we do early? What types of medications might treat hypertension better? There's a lot of study with aspirin therapy and preeclampsia and other types of things that really can be helpful. So really taking a lot of that information and being able to apply AI to it to help create additional solutions in the future, I think is one way that we'll be able to see AI really, really help with the predictive and the predictive analysis on supporting treatments for moms.
Yeah, I saw that there was a case where I guess there was a veterinarian who didn't know how to treat certain disease or animal or something like that, and they were able to use AI to help, and they saved the animal, which is amazing, right? And ultimately, we want AI to be used for that and not Terminator stuff. So, but yes, hopefully AI stays for the good, and it's quite cool to. I don't know if you've ever sat down and went through ChatGPT and asked it things, and it's addictive.
I will say that I have gone in and typed in how, what are the prevention strategies for postpartum hemorrhage. And it was obviously it was able to pull from different things. It was actually pretty accurate.
Right.
I was pretty surprised.
And I think the biggest thing is it's very, I want to say textbook oriented, right? So it's almost like what it spits out is out of a textbook, right? Which is a good thing. And I think eventually as AI evolves, it'll be a much more natural way of speaking and more able to adapt to each situation better and not have like the same answer for different problems.
And that right there for now is part of the challenge with AI is that it's very generic as opposed to being individualized per patient, for example.
Precisely.
And one of the areas that certainly may benefit from that type of technology, and certainly kind of getting back to the technology question that you asked, is there are what are called maternal health deserts in the United States that it would literally take you a drive of hours to find a provider for even well woman care. And so being able to utilize, remote, and, telehealth, a remote connection between a patient and a provider to be able to receive healthcare is really important. And, part of the challenge with, ChatGPT and others is that, patients can very easily now type into ChatGPT, please diagnose this. And so it's critical that patients are still engaging with their providers, even though ChatGPT might be an avenue to kind of at least get some information.
I don't know if you're familiar with Reddit, but it's much better than that platform because people think they have cancer whenever they have a small rash on their arm because that's what happened to one person 35 years ago, But.
So obviously there's a lot to learn. There's a lot to be learned.
Yeah.
And so, technology is evolving very quickly and much more quickly than any of us will. I mean, this is a really pivotal point.
Yeah.
And in fact, just back in 2018, if I remember the number correctly, the New England Journal of Medicine had said that the amount of data being created was about 2,314 exabytes that we would need to be able to have that much storage.
So what is that like?
So one exabyte,
Exabyte.
one exabyte
Yeah.
is 1 quintillion bytes.
Quintillion bytes.
So 1 quintillion times
Yeah.
2,300.
gigabytes?
No,
Like when you say bytes, you mean gigabytes?
yeah, just like 1 byte.
Yeah.
So 1 byte,
Okay.
1 quintillion bytes
Okay.
times 2,314.
That's a big number.
That's a big number.
Yeah.
And so I was actually using that number in a presentation I did last week. And the only thing that could even give you the remote idea of that type of number is I equated it to I equated it to like the explosions that occur like in a Transformers movie. That type of size and that type of velocity that occurs like in that type of explosion is that type of number. You can't even quantify that number, and
Wow.
it's amazing the vast amounts of data that is being produced in healthcare, and that's in healthcare alone.
And I guess the double-edged sword about AI is that as it evolves, it will continue. As we evolve it, it will continue to evolve itself. Right. So that's something else that, it's just the thought behind it is scary and cool at the same time. But all right, so we'll move on from ChatGPT and AI. But yeah, I just thought that would be pretty interesting. So can you speak to the importance of collaboration and partnerships in achieving the goals of the Paternal Neonatal Quality Collaborative in Rhode Island?
So really the term collaborative in it is really what is so important about this is that it really takes all the voices and the actions of hospitals, providers, community members, doulas, nurses. I mean, just the list goes on. It's really important to remember that that really kind of connecting the dots in all of this and being able to harness the expertise and leverage that information and that insight is really what's going to drive the success of the organization, and quite frankly, the collaborative within Rhode Island. There are difficult conversations to have. There's difficult funding conversations to have. In many states, the Perinatal Quality Collaborative is funded by the state. It's written into legislation. And so we hope that one day there will be the opportunity for Rhode Island to write into legislation the Perinatal Quality Collaborative as it is written into law in so many other states because of its importance, because of its necessity to be able to connect these individuals and communities and organizations to heighten awareness of maternal health, but also create solutions both in hospitals and the community.
Yeah. It's I think, vital to a lot of different organizations that are at the government level or health organizations to get help from other organizations, right? Because you can't be good at everything. And that's something that's when you get to a small business level, that's a reason why a lot of small businesses fail. So it's great that you guys are introducing that into this. It's vital to keep these organizations alive.
No,
right?
it's so true. And
Yeah.
as we have all found as we've come together, there's lots of great work happening simultaneously in silos. And so how do we bring all of that good information together? How do we bring the voices together? How do we make sure that, there may be duplication of efforts in some ways, and for good reason. But if there's duplication of effort that could be harnessed and have additional collaboration around those, then you can utilize funding, for example, or grant funding in much more achievable and dynamic ways so that you're not basically spending money on 2 or 3 of the exact same projects. You can kind of bring those thought leaders together to be able to make that work in a much more streamlined and connected way.
Yeah, great. So I want to sort of backtrack a little bit to the beginning of the podcast when you had mentioned about going to college for little to no cost, and then working, right, for that particular company that may sponsor you for a couple of years. So is there plans within this organization to help mothers out who might need help in their careers as well, when it comes to mental health and after birth, and then let's say they're on, welfare or something like that, and they need help with their career? Is there a way where you guys are going to maybe partner with colleges or universities to help these mothers maybe get into a different career and sort of have that, same system applied?
I would love to say that we have that much bandwidth right now.
Yeah.
That's probably, we would certainly welcome that type of engagement in the community. We're probably not quite there yet. We're still we're focusing on the very acute areas right now of making sure that moms have what they need for a healthy pregnancy, for a healthy delivery, and then a very safe, sound postpartum period. We're making sure that they have what they need for their first year post delivery, and that that they can be healthy and their families can be healthy. Of course, we want to support any opportunity for a new mom to be able to elevate herself, elevate her future. That's probably outside of our scope at this point to be able to engage with that type of work.
Yeah, absolutely. All right. Thank you. Thanks for listening. Will it? All right. I think we're gonna leave that in. I think we're gonna leave that in. The FedEx guy doesn't take a hint that we're sitting in front of two mics with a camera.
Well, you know what? That's part of.
Yeah, we're gonna leave that.
I'm gonna say that's part of healthcare. You just go with the flow.
So yes, we're gonna leave that in. But
getting back to what you were saying. It is, again, I think that is so crucial and so important, and there will be organizations that will be able to help support new moms and, quite frankly, new families in being able to achieve educational goals and, their ability to kind of grow in their own lives. At this point, we just want to make sure that moms are healthy, that moms are able to get what they need for themselves and their babies after delivery, and for that first full year postpartum.
Yeah, absolutely. So I think it's good to maybe start winding down here. I got a couple of last questions for you. So I think the last question regarding this whole system is, looking to the future, what are some of the key priorities and goals of for the collaborative, and how does it plan to achieve them?
So I think that there certainly are a couple. Number one, being able to receive funding to be able to support the team that is able to kind of do this work, and spearhead it on a full-time basis. We have some really great volunteer leaders who are doing this, but in most other states, this work is funded, whether it be through a national grant, whether it be through a state grant or state legislation. This work is routinely funded, but Rhode Island is young. We're young in this process. We're one of the last states in the nation to have a perinatal quality collaborative, so we're a little late to the game, but better late than never.
Yeah, sounds about right for Rhode Island.
But we're here and we're working on achieving some funding goals.
Absolutely.
So beyond that, really, I think really kind of ensuring that we have all voices at the table, that we have the ability to really connect individuals and programs together to make sure that people know that they're out there, and that achieving that goal, I think first is really making sure that the connections are there, the people are there, the organizations are there, and that we can receive the funding that we need to be able to carry on this very important work.
Absolutely. Yeah. So I guess the last question I have for you, and I end every podcast with this question. If you were to leave one piece of advice to the listeners, it could have to do with your career, it could tie back into your personal life. What would that piece of advice be?
It would be, so when I was in my PhD program years ago, I had a professor tell me, don't miss the changing of the leaves. And it was spring. And I remember vividly hearing that statement, don't miss the changing of the leaves. And I thought, what does that mean? Well, I felt like I blinked my eyes and the leaves were there and then they were all on the ground. And what she was telling me was, don't miss the little things. Don't miss the small opportunities. You may be busy, your head may be down, but don't miss going out to walk in the grass. Don't miss the leaves that are green and suddenly are vibrant brown and red and yellow. Don't miss those opportunities. So what I would say is, don't miss the small things. Go walk in the grass and make sure that you can connect, that your purpose is very important, but don't forget to connect purpose to those things around you that support your purpose. I think that's really important.
Absolutely. And I love the short and to the point inspirational quotes because you can interpret them in any way you want. It's not, I've said this before on the podcast, it's not telling you how to live your life. It's not, saying you have to do this or you're going to fail. It can be interpreted and applied to anybody's life. So I love that quote, and thank you very much for sharing that advice. And thank you so much for coming on and taking time out of your busy day. This has been a very eye-opening and educational conversation for me, and I really appreciate it.
Well, no, thank you for the opportunity and introducing, the audience to the National Perinatal Information Center, as well as the Perinatal Quality Collaborative in Rhode Island.
Absolutely,
Really
that's
happy
a tongue
to do
twister. That is, you've gotten very good at saying that. I wouldn't be able to say that as fast as you can. So instead of me trying to say that again, let's just end it.
That's great. Thank you so much.
Thank you very much, and thank you all for listening to the Knowledge is Power podcast. And make sure to follow us on Instagram, and we are on Facebook now. And if you're interested in getting episodes early before they are posted on widely available platforms, subscribe on Patreon. So thank you so much, guys. Thank you again for coming on, and I'll catch you in the next one.